This here is the model of a human eye, and we get to see all the different structures within our eyeball. We start with the external structure here. This is the cornea, and this is the outer shell of your eye. The cornea generally is going to be either shaped like a golf ball or like a football. If it's shaped like an American football, long one way and steep the other way, we call that astigmatism. Behind the cornea, we have our iris, and the iris is where your pupil is located. And then right behind that, you're going to see on cross section here is this lens. This is a sac of protein. The proteins are, at first, when we're younger, very flexible and they bend quite a bit, and it allows for dynamic vision to occur as the lens of the eye flexes. The ability for us to see distance versus near is shifting. It's called accommodation. As we all age and we get generally in our fourth decade of life, this lens here is thick enough that it loses that flexibility. The accommodation reduces. Generally in our kind of mid to late 40s or early 50s, most people start reaching for reading glasses if they're accustomed to seeing well at distance. After that, this lens protein continues to thicken over our lifetime and discolor, and there's different characteristics and patterns it can have that eventually either block the light rays trying to get to the back of the eye and land on the retina, or just cause scatter of the light. So as the light comes through, it's no longer focusing into your retina. That creates a lot of glare. A lot of complaints from people with cataracts would be nighttime driving has now become more difficult. Oncoming headlights, they're seeing just a lot of scatter of light or just difficulty navigating. Generalized blurriness during the daytime is also a common complaint of cataracts. People that golf and sort of watch the golf ball fly, they start to lose the ability to track the golf ball. So cataract surgery, what are we doing? Well, we're not taking anything out of your cornea or changing that. We're not changing your iris. All we're doing is actually just removing this little, opening the sac of protein here to remove all the cloudy protein and replace it with a clear lens of your choice to refocus the light to land it in the back of the eye. This will help to open up the visual pathway and help you to have much better clarity long term, because now you have an artificial lens implant in your eye. The length of your eye is a constant. The corneal curvature is a constant. Once you have the lens replaced, that's fixed. It's a constant. For the rest of your life, you can expect high quality vision because you've had cataract surgery, assuming you don't have other issues with your eyes, such as retina problems or optic nerve disease, those types of things. 20% of all patients can get a little scar tissue on the back of their lens implant. Technically, it's not a cataract, but it can behave visually similar to what your cataract was doing. It can cause a scatter of light, cause a little fog in the vision. Sometimes it's a really significant blurriness. If that does develop, there's a simple treatment that we have. It's a machine with a laser on it that we can shine through, focus it on that scar tissue. And just like you open a window shutter, we can open the scar tissue to let the light pass through into the back of the eye. It's generally a one-time treatment covered by insurance, and then you're up and running just like you were right after your cataract surgery.